Hello, sir. Myself Sharma Peeyush from Group 3009, and today we are going to discuss about conditions of cholera in India. In this topic, we are going to discuss about history, current situation and trends, statistics, legislation, laws, orders, policies and programs, preventive measures and conclusion. The first cholera pandemic occurred in the Bengal region of India near Calcutta starting in 1817 through 1824. The second pandemic lasted from 1826 to 1837 and particularly affected North America and Europe due to result of advancements in transportation and global trade and increased human migration. The third pandemic erupted in 1846. The fourth pandemic lasted from 1863 to 1875, spread from India to Naples and Spain. The fifth pandemic was from 1881 to 1896 and started in India and spread to Africa. The sixth pandemic started in India and was from 1899 to 1923. Symptoms of this disease includes watery diarrhea, rice water stools, fish odor to stools, vomiting, rapid heart rate, loss of skin elasticity, dry mucous membrane, low blood pressure, thirst, muscle cramps. Current situation of this disease is cholera cases reported in 2016 132 121, cholera cases and 2420 deaths. As shown in graph, the number of incidents in India is highest in Maharashtra, Bengal and Orissa. The morbidity indicator in the year of 2010, 11, 12, 13, 14 and 15 shows that Bengal shows the highest rate of occurrence of this disease. Around $20.2 million in out-of-pocket expenditure, 8.5 million in public sector and 12.1 million in lost productivity in 2015 were financed. This outbreak caused the highest number of deaths, which is of 353 in West Bengal. For this, the Indian government have passed the Epidemic Disease Act in 1897. According to the Epidemic Disease Act, it was first enacted to tackle bubonic plague in Mumbai, formerly Bombay, in former British India. This law is meant for containment of epidemics by providing special powers that are required for the implementation of containment measures to control the spread of disease. The act has been routinely used to contain various diseases in India such as swine flu, cholera, malaria and dengue. In 2018, the act was enforced as cholera began to spread in the region of Gujarat. Power to take special measures and prescribe regulations as to dangerous epidemic diseases. When at any time the state government is satisfied that the state or any part thereof is visited by or threatened with an outbreak of dangerous epidemic disease, the state government, if it thinks that the ordinary provisions of the law for the time being in force are insufficient for the purpose, may take or require or empower any person to take such measures and by public notice prescribe temporary regulations to the observed by the public. Powers of central government. When the central government is satisfied that India or any part thereof is visited by or threatened with an outbreak of dangerous epidemic disease, at that an ordinary provisions of the law for the time being in force sufficient to prevent the outbreak of such disease. Penalties are also decided. Any person disobeying any regulation or order may under this act shall be deemed to have committed an offence punishable under section 188 of the Indian Penal Code and 45 of 1860. Protection. No suit or other legal proceedings shall lie against any person for anything done in good faith intended to be done against this act. Here are the DLT and QLT graphs for the cholera in India. It is important for public health authorities in southern Asia to consider options for the control of cholera in multiple settings in India. These authorities are MOHFW. At the center and the states, MOHW liaises on health-related matters with the multiple stakeholders in health and other fields, including ministries that supervise sanitation, water for women, children, finance. Measures taken by the government are use latrine or other sanitation system like chemical toilets or dispose of feces. Wash hands with soap and safe water after defecating. Clean latrines and surfaces contaminated with feces using a solution of 1 part household bleach and 9 parts of water. Efficient treatment reside and prompt rehydration through the administration of oral rehydration salt (ORS) and intravenous fluid depending on the severity of cases. Up to 80% of patient can be treated adequately through the administration of ORS. Treatment of cholera is rehydration. The goal of the rehydration phase is to restore normal hydration status, which should no more than 4 hours. Set the rate of intravenous infusion in severely dehydrated patients at 50 to 100 ml per kg per hour. Lactated ringer solution is preferred over isotonic sodium chloride solution because saline does not correct metabolic acidosis. Concluding this whole presentation, the India has a robust mechanism of decision making on policies for vaccine introduction, and this process has been initiated for oral cholera vaccines. The lack of strong reporting systems and surveillance is the key need that has to be addressed both in order to measure the burden and evaluate the impact of vaccines and other intravenous which introduced. Oral cholera vaccines are now available and affordable, and the government should consider how best to use this valuable tool in addition to the complementary approaches for prevention of a major public health problem. Thank you.